So, Assalamualaikum warahmatullahi ta'ala wabarakatuh. So, let us continue our discussion for Unit 8. Okay, so the basic nursing procedures. So, kanina sa part 1, discuss natin yung medication or administering medication. So, now, let's discuss the intravenous fluids or IV fluids or in layman's term, these are known as dextrose. Okay, so yung mga binibigay natin ng mga dextrose sa ating mga patient in times na nasa hospital sila. So, what are IV fluids or intravenous fluids? IV fluids are liquids injected into a person's veins through an intravenous tube. They prevent or treat dehydration and electrolyte imbalances. Yun po ang main goal ng ating IV fluids, no? To correct electrolyte imbalances or to correct or treat dehydration. Especially sa mga pasyente na ang case niya is diarrhea. So, dahil sa frequent yung kanyang pagtatae, so nawalan din siya ng tubig, nagkaroon ng dehydration, so we need to treat their dehydration. So, why are intravenous fluids are used, okay? So, water is very essential to every cell in our bodies. In fact, our bodies are made up of about 60% of water. That is why, masyado tayong mabigat, no? Isa yun sa mga malaking nakaka-contribute sa ating weight, ang tubig. So, when you don't have enough water in your body, that is called dehydration. And a person needs IV fluids when they become dangerously dehydrated. So, kumbaga doon pa lang sa sinabi niya is that IV fluids are used to replenish the fluids that is lost, okay? Kahit ano yung reason bakit nawala yung fluids sa ating katawan. Kasi nga, our body is composed of 60% of water. That is why it is very important that we stay hydrated and we avoid as much as possible dehydration. Kasi once na magkaroon tayo ng stage na very severe na yung dehydration natin, pwedeng maging dehydrated ang ating brain. And we don't like that because pwedeng magkaroon ng poor circulation sa ating brain that would lead to brain death. Okay? So, serious dehydration may occur when you are sick or when you are having diarrhea. Exercise too much or spend too much time in the heat without drinking enough. So, pwede magkaroon ng heat stroke. This can lead to severe dehydration. Or have a serious injury or burns. Or have surgery, especially when you're asleep for a long time or unable to eat or drink. So, what happens during rehydration with IV fluids? If you need IV fluids, a healthcare provider will decide the type of IV fluid you need, determine the amount of fluid you need, and how quickly. This is based on many factors, including your weight, age, and medical conditions, in which yung mga doctors na po yung nagde-decide sa mga ganyang cases. Hindi na po yung mga nurses yung nagko-compute or ano ba yung type ng IV fluids ang kailangang ibigay sa kanila. However, it is very important that we nurses have the common knowledge regarding on the IV fluids. Kasi may mga times na kayo mismo, based on your observation as a nurse, magbibigay ng IV fluids. So, disinfect or clean the skin where the IV will go, usually on the inside of the elbow or on the top of the hand. Tie an elastic band or tourniquet around your arm to make blood fill the veins. Examine the veins to find the exact insertion site and slide a sterile needle into the vein, which may pinch, and the needle will have a small plastic tube at the other end of your body. So what happens during sorry. Ito yung process ng pag-insert, no? And then remove the tourniquet, place a small plastic attachment onto the tube, test the tube to make sure a little bit of fluid can go in, tape the IV fluid into your arm so that it stays in place, attach the tube to a longer tube and then attach it to a bag of fluids. Hang the bag from a hook on a tall stand called an IV stand and turn on the machine that will pump the IV fluid into the IV line and check your IV line regularly and monitor the amount of fluid entering your body. So, yun po yung process ng pag-start po ng ating IV insertion. So, itong skills na to, you will learn this when you become third year because it is an advanced and it needs a lot of knowledge. Hindi lang kasi nag-insert tayo. Kailangan meron din tayong idea para saan yung ibibigay natin, ano yung mga veins na specific na pwede nating i-insertan, ano yung mga areas na kailangan nating i-avoid, so mga ganyang procedures. So what are the advantages and risks of this procedure? So IV rehydration is a common and simple safe procedure that can make you feel better quickly and help save your life if you are seriously ill. But rare complications can occur. So ito yung mga rare complications na pag ito din ay napabayaan ng ating mga nurses or negligence, ito yung pwedeng mangyari. We have air embolism. An air embolism or gas embolism occurs when an IV pushes too much air into the vein. It is very rare but can have serious consequences, including possible death. That's why it's very important that when we give medications, kailangan walang mga air or bubbles doon so that we cannot administer air directly into the vein. Next one is the collapsed vein. Sometimes the vein collapses when the needle is inserted or an IV is in place for a long period of time. Usually, ang ideal kasi ng pagbigay ng the IV, yung area kung saan ka tinusukan, tumatagal ng 48 to 72 hours. Dapat napapalitan yan siya. However, dito kasi sa atin, hindi siya practiced masyado na papalit-palit tayo kasi nga ayaw din ng ating pasyente. At syempre, mahihirapan din tayong nurse na paulit-ulit. Pero pag sa abroad kayo, sa Saudi specifically, after 48 hours, usually 70 or maximum of 72 hours, pinapalit na talaga yung inserted na IV line. So if this happens, your healthcare provider will try to find another vein to use. There are many other veins to take over the collapsed vein. Next is fluid overload. If too much fluid is given too quickly, you can experience headache, high blood pressure, and trouble breathing. This usually results quickly with an adjustment to all fluid levels, but it can be dangerous. That's why you need to regulate the IV fluid. Pag sabihin ng doctor 30 drops per minute, kailangan 30 drops per minute man. Especially sa mga pasyenteng matatanda or may cardiac problems, kailangan very regulated or well-regulated ang kanilang IV fluid. So, another mga serious injuries or complications, we have also hematoma. A hematoma occurs when blood leaks from the blood vessels into the nearby tissue. It looks like a bad bruise and usually goes away in a few weeks. Nangyayari yun pag nagkamali tayo ng insert, okay, nag-collapse siya, and then magkakaroon ng hematoma. So infection, if the area is not clean when the needle is inserted, infection may occur. Your healthcare provider can usually treat infections with antibiotics. Next is we have the infiltration. If the needle moves or gets dislodged, especially pag naidiin ng pasyente yung kanyang kamay kung saan naka-insert yung site. So, paminsan ganyan yung nangyayari. So, nagkakaroon ng infiltration or nagde-dislodge. Fluids can enter tissues around the vein and this may cause stinging and bruising, but it's typically easy to resolve. Pwede lang warm compress, okay, and then cold compress, and then mawawala din siya. And we have also phlebitis. This occurs when the vein becomes swollen because of the IV. It is one of the more common complications, but is usually treatable by removing the IV, applying a warm compress, and elevating the arm. So we have here the types of IV fluids that we can give to our patient, especially on the ito yung mga andito yung mga uses niya. So we have isotonic, we have hypotonic, and hypertonic. So we have three types of solutions that we can give. It's either isotonic, hypotonic, and hypertonic. Pag sabihin natin isotonic, yan yung ninormalize niya yung number of water and electrolytes in our body. Parang the same lang siya ng content ng ating katawan and then hindi siya dumadagdag ng too much electrolytes or too much water sa atin that may cause further imbalance. Okay? Pag normal lang siya, the same lang siya ng equilibrium. Pag sabihin naman nating hypertonic, so from the word hyper, mas mataas yung content niya ng salt or solute. Okay? Kaysa sa solvent or the water. So, medyo mataas yun siya. So, usually ito ginagamit to siya or binibigay to siya sa mga pasyenteng dehydrated masyado and we need to kumbaga, retain water as much as possible. So, paano ba natin ma-retain yung water? So, we need to have increased solute so that it can attract water, such as yung pinaka-basic kasi na ginagamit natin na solute sa ating IV fluid is the salt or the sodium. So, yan siya, it's nakakatulong in retaining water. And then, for hypotonic, sila naman yung, this can be used for patient na, ano to, pag sobra-sobra na yung nai-release na nila, so kailangan nating mag-stay din, okay, ng water, so hypotonic. So, mababa ang kanyang, uh, ano to, solute pero mataas ang kanyang solvent or the water. So, ito yung mga pwedeng solutions. We have D5 water. It is an isotonic. We have also 0.9 sodium chloride or yung tinatawag nating PNSS, okay, or the plain normal saline solution. We have also lactated ringer, okay. And then for hypotonic, we have 0.45 sodium chloride. And for hypertonic, the usual is dextrose, 5, basta may word na dextrose, 5%, 10%, except for dextrose na water, that is isotonic. The other, basta dextrose with normal saline, water, 10% in water, okay, and then sodium chloride, that is a hypertonic. So, yung isotonic, this can be used for fluid loss, dehydration, hypernatremia, shock, blood transfusion, resuscitation, fluid challenges, or DKA. For hypotonic, water replacement, DKA, or gastric fluid loss from NGT or vomiting. For hypertonic naman, this can be used for temporary treatment for shock if plasma expanders aren't available, water replacement, and conditions where some nutrition with glucose is required. So, ito yung mga special considerations natin, no? Use cautiously in renal and cardiac patients. This can cause fluid overload sa ating D5 water. Okay, sa ating isotonic na PNSS, this can lead to overload and use with caution in patient with heart failure or edema. Okay, for isotonic naman na lactated ringer contains potassium, do not use with renal failure patients, and do not use with liver disease that can metabolize lactate. So, ito, tandaan natin yung mga special considerations kasi once makita natin, we need to take note of that na pwedeng yun yung mga side effects na pwedeng mangyari sa ating patient. For hypotonic na 0.45 na sodium chloride, used with caution, this may cause cardiovascular collapse or increase intracranial pressure. For hypotonic na normal saline, use only when blood sugar falls below 250 milligrams. Do not use it in cardiac or renal patients and monitor blood sugar levels, especially when we use dextrose 10% in water. The word dextrose naman is, pag sabihin natin dextrose, meaning the IV fluid has content of sugar. Okay, meron siyang glucose na in which hindi siya masyadong binibigay sa mga pasyente na may diabetes mellitus. Okay? So, ito yung mga itsura niya, no? We have the 5% dextrose water, the red one. And then the green one is the 0.9% sodium chloride. We have the lactated ringer, the blue one. The violet actually. Then we have the 5% dextrose in 0.3. And then we have also balance, BMMS, okay, or pwede siyang NMBB, NMBB. So, yan yung mga samples, itsura po ng ating IV fluid. So, now let's talk about the computation. So, ito yung mga kailangan nating malaman, okay, na mga i-compute natin. So, we have here the hours to run. So, ilang hours daw po tatakbo yung ating IV. Okay? Na yung isang bottle ng 1,000 ml or 500 ml, ilang hours yun siya na magfo-flow na makikita mo na, okay, mauubos na siya. So, we need to calculate that one para ma-anticipate natin na, okay, around 9 a.m., magsa-stop na or mauubos na yung IV fluid. We do not wait to have it completely, kumaga zero na talaga, walang laman yung IV fluid kasi pwedeng mag-backflow yung dugo and then makikita mo na lang sa IV fluid, IV bag mo, instead of IV fluid, nakalagay is dugo. So, we have here the macro set and microset. Magkaiba po yung ginagamit natin for an adult and for a pedia. Okay? Kasi mas manipis yung needle ng ating pedia compare sa adult. Okay? So, ito pag macroset ang ginagamit natin, we have here the ito yung consistent talaga or constant na formula. We have volume of solution, it's either 1000 ml or 500 ml times 15 drops per ml. That is the drop rate. Okay? Sorry, drop factor. This is the drop factor. Ito yung tinatawag nating drop factor. And this is very, kung sabihin nyo, ma'am, pwede po itong palitan. Hindi, ito ay constant. Pag sabihin natin macroset, automatic ang drop factor niya is 15 drops per ml. At pag microset is 60 drops per ml. And then over is the drop rate. Okay, ano yung order? Okay, the drop rate. Ano yung order ng ating doctor? Example, sabihin niya is 40 minutes per 40 drops per minute. So, yan yung ating drop rate. Okay? And then, times 60 minute over R. And then, dito nga, pareho lang din siya. Ang pinagkaiba lang natin is the drop factor in which dito sa macroset 15, dito sa ating microset 60. So, example, hours to run, sabi niya dito, 1 liters. Meaning, pag sabi natin 1 liters, it is 1,000 ml. Okay? Ang drop rate niya is 30 drops per minute. So, dito ilalagay natin 1,000 ml. Dito ilagay natin 15 kasi it is an adult. Sabi niya nga, di ba? So, dito ang ating 30 drops per minute times 60. So, cross out natin to siya. Okay, and then 15,000 divided by 1,000 R, meaning we have 8 hours. So, 8 hours po ang iraran ng ating D5LR na 1 liter with the drops of 30 30 drops per minute. So, example na natin nabigay ka 9 a.m. So, bibilangin mo yan siya hanggang 8 hours lang. So, 9, 10, 11, 12, 13, 14, 9, 10, 11, 12, 1, 2, 3, 4, 5. By 5 p.m., mauubos na yan siya. So, pwede na nating palitan ng another IV bottle. So, yan din. The same lang, no? Yung ating, calculation. And then for pedia, ito naman yung for pedia. Okay. So, yan siya. GTTS, 60 po ang gagamitin natin na drop factor instead of 50. So, multiply lang natin and divide lang natin yan siya. So, actually, it's very easy if you just memorize the formula. And then for drop rate computation, so ito yan siya. Ito yung gagamitin natin, no? Pag naman ang i-compute natin is the drop rate. Okay? So, we have here, for example, hindi binigay yung drop rate. Sinabi lang ng doctor, okay, give, 1 liter of NSS for 8 hours. So, tatanungin mo, Doc, anong regulation ng IV. So, you need to compute that one. So, the same lang siya. Ang nakalagay lang dito sa baba, instead of drop rate, it is the hours to run na sinabi ng doctor niya. Okay? So, ayan. So, example lang natin, ayan, sabi ng doctor is for 8 hours. And then, dito ilalagay ninyo 1,000 ml times 15. 8 hours, ayan siya. So, meaning ang drop rate niya is 30 drops per minute. So, ayan din, for yan, 40 drops per minute. So, ayan yung mga ating no? So, a physician orders D5WIV at 125 ml per hour. The infusion set is calibrated for a drop factor of 10 drops per ml. Calculate IV flow rate in drops per minute. So, nilagay dito is, good, dapat daw per 1 hour, 125 ml. So, times daw natin siya, calibrated siya, drop factor niya is 10 drops per ml. So, times natin yan siya, 125, ayan siya. So, dito kunwari yan. And then, 125 times 10. Hindi po natin siya i-divide dito, ha? Hindi natin 125 divided by 16, no. 125 times 10. Okay. And then 60 times 1. And then that would be 20.8 drops per minute. Or pwede siyang 21 drops per minute. Okay, so yan po ang tamang pagka-calculate. Next, let's talk about the IV cannula. So an IV cannula is a technique that is utilized in order to place a cannula into a vein in order to provide some form of venous access. This sort of access will allow medical professionals to get a blood sample as well as infusing fluids to the patient to avoid dehydration and at the same time providing vital nutrients, medications, chemotherapy, and other transfusions. So, the importance of selecting the right gauge. Okay? So, gauge po yan ha. So, yung IV cannula natin, yan yung needle. So, ito yung makikita ninyo. So, each dapat meron tayong pagpipili ng gauge na yan. Kasi, yung needle is pag sabihin natin gauge, the longer, the lower yung gauge, mas malaki yung needle. Okay? Pero pag malaki yung gauge natin such as 28, maliit yan siya. So, the reason it's important to use the right gauge is because some nursing procedures can only be done with a particular sized needle. For example, if you have a patient who needs to have his her blood drawn, you'll want to go with a gauge large enough to do it. Otherwise, you may end up having restrict them with a properly sized gauge. This can cause the patient frustration and pain. Therefore, whenever you start an IV on a patient, you want to ask yourself what type of procedure your patient will be having while in your care. Here are some common uses for different gauge sizes, generally speaking. So, pag sabihin natin 16 gauge, ito yung mga iba't ibang gauge ha. 16 gauge, this is normally used in ICU or surgery. So, pwedeng pag i-operahan yung pasyente nyo, 16 yung gagamitin natin. This large size enables many different procedures to be performed such as blood administration, rapid fluid administration, and so forth. Pag sabihin naman nating 18 gauge, this size allows you to do most tasks that the 16 gauge can, but it is large and more painful to the patient. Pag 20 gauge, you may able to push blood through this size if you can't use 18 gauge, but always check your employer's protocol. The size is better for patient with smaller veins. 22, this small size is good when the patient won't have IV for long or aren't critical. You usually cannot administer blood using this kind of gauge because it is too small. And pag sabihin natin for 24 naman, this size is used for pediatrics and usually used only as a last resort as an IV in the adult population, especially sa mga elder people. So ito po yung mga gauges natin, no? So ayan, we have 14, the orange one. Okay. Recommended siya para sa mga trauma, rapid blood transfusion, or surgery. The gray one, 16. Okay, rapid fluid replacement, trauma, and rapid blood transfusion. For green, the 18. Rapid, okay, the same lang din siya na with the orange and gray. And then for pink, the 20 gauge. Most infusions, rapid fluid replacement, trauma, routine blood transfusion. For blue, that is 22, most infusions, and for neonate, pediatric o pwede ding older patients. And then yellow, 24, that is most infusion, neonate, pediatric, or older adults, routine blood. And then for purple, that is 26, that is mostly used for pediatrics or neonate. So that's all for IV. IV fluids, okay, or intravenous fluid. So now let's talk about naman the last concept or topic na i-discuss natin sa Unit 8, the nursing care plan and the nurse's notes such as the SOP and FDAR. Okay, so let's talk about first the nursing care plan, no? So nursing care plan from the word plan. So this is a type of documentation, a type of document that can be utilized by the nurse as the plan. So pwede to siyang mag-outline ng mga goal ninyo, okay, by utilizing the process of nursing process. So ito pong i-discuss ko na documentations or documents such as nursing care plan, SOP, and FDAR, ang ni-utilize po natin talaga dito is the nursing process in which we assess, we diagnose, we plan, we implement or intervene, and lastly, we evaluate the care that we have rendered. So, Ano ba si nursing care plan? Nursing care plan utilizes nursing process to construct an individualized plan of care for a patient based on a critical analysis of patient assessment data. So again, ano po yung ginagamit ni nursing care plan na process? The nursing process. Without assessing, without diagnosing, without planning, without implementing, without evaluating, wala tayong magagawa ng NCP. So, paano ba or para saan ba tong NCP? So, it is a written guideline for client care and it is an established plan of care based on the prioritized needs of the patient. It is very important that we need to plan, okay? Na may plano tayo with regards sa case ng ating patient kasi meron tayong goal, meron tayong direction. So, this is the purposes of nursing care plan. It organizes the work of the nurses. This coordinates resources of care and also enhances the continuity of care. That is why it's very important na meron tayo. Na pag ma-meet mo yung pasyente mo, ito yung case niya, ano kaya yung magandang plano ko na implement sa kanya? Yes, mahirap siyang gawin kasi hindi tayo na set up dito lalo na sa Philippines na primary nurse na 1:1 kasi nangyayari is the whole population of the ward, ikaw talaga lahat. So, nakakasad yun siya na hindi mo na-implement ng maayos yung interventions ninyo. Okay, so totoo kasi yan na nangyayari. So, ito yung itsura ng ating nursing care plan. So, cues ang ilalagay dito is subjective and objective cues. Di ba? Pag sabihin natin subjective, yun ang mga cues na na-observe ninyo. I mean, nasasabi ng inyong pasyente na feel niya. Okay? So, that is subjective. Pag objective naman, ito yung nakikita ninyo, na-observe ninyo, na-examine ninyo. Okay? Such as the vital signs, okay? Yung pagiging facial grimace niya, yung mga behaviors niya, and then the nursing diagnosis is usually based sa NANDA na approved ng libro. So again, it is approved by the nurses organization. And then the objectives, the goals. Okay, within 8 hours of your care, ano yung goal mo, the ultimatum na gusto mo mangyari sa inyong pasyente. And then for the interventions, it starts with independent and then dependent and then interdependent. So I don't need to discuss it further kasi na-discuss na natin to on the previous units, the nursing process. And then we have the rationale. Bakit natin ginagawa yung specific na intervention? That is why, di ba, sa inyong skills, hinahasa kayo na gumawa ng rationale kasi it's very important that you know what is the reason why you are doing this kind of procedure. And then for the last one is the evaluation. Again, this is a plan, meaning it is futuristic. So these are the sample. Sample lang. Subjective, sabi niya, masakit at nahirapan ako dumumi as verbalized by the patient, no? So, ang objective mo, guarding behavior. Okay, kunwari, masakit yung tiyan niya, ginagarda niya. Restlessness, facial mask of pain, vital signs taken as follows. Ito yung kanyang vital signs. And then, ang nursing diagnosis mo, acute pain may be related to inflammation and edema of prolapse varices. So, inference kasi ito usually, hindi to siya mostly ginagamit dito sa type of NCP sa atin dito sa Philippine setup. And then for planning, we have after 8 hours of nursing interventions, the patient will report pain is relieved and controlled. Kasi nga, acute pain, dapat ang overall na goal mo is mawala yung pain niya, no? Malesen. For intervention, we have independent. Okay, yan siya. And then we have the rationale and then evaluation after 8 hours. Okay, so yan yung ating nursing care plan na example lang. So we have also here dito, yan, mainit ang pakiramdam ko. So sa kanya dito, hyperthermia, meaning may lagnat daw as related to increased metabolic rate or illness. So yan yung mga ilan lang sa mga samples ng nursing care plan. So I hope it is very clear kung ano pa talaga yung nursing care plan. Again, it gives a direction, it gives us a established plan to provide a good care para sa ating patient. So now let's talk about the nurse's note. So we have two different types of nurse's notes that can be used in documenting. It's either SOAP or FDAR. So documentation is a crucial aspect of patient care because it provides healthcare professionals with important information about a patient's past and current medical status. Kaya nga 'di ba, dapat lahat ng ginagawa natin, it ends with a documentation. documentation. You need to document all of the procedures that you have done to your patient. Preparing optimal patient progress notes that includes relevant details requires specialized knowledge and practice. A standardized documentation framework like SOPI or FDAR charting can help healthcare providers write comprehensive, organized progress notes that support high quality patient care. So, nurses' notes can be known as progress notes. So, from the word progress, it notes all the progress of the patient kasi dapat may improvement eh. So, kaya ka nga nandiyan dyan yung pasyente, tinitit nyo siya. Kung pag mo lang makita progress, meaning hindi nag-improve yung pasyente ninyo at hindi maganda yung implementation ng or mga interventions ninyo. So, we have here the SOPI. So, SOPI stands for subjective data, objective data, assessment plan, implementation or intervention, and evaluation. So here we have the charting tips for SOPI. First one is to review identifying information on each chart to ensure that you are updating the correct file. Itong SOPI na to is parang katulad lang siya ng ating nursing care plan, but this SOPI is a past, okay? Meaning kasi pwedeng gawin ninyo ganito yung technique eh. Gagawa ka ng plan mo. And then, tamang-tama yung plano mo is ngayon na-experience ng pasyente mo. So, pwedeng gawin mo na yung NCP na ginawa mo is gawin mo siya pang SOPI na past tense. Meaning, nagawa mo na. Kasi nga, na-implement mo. Such as, na-implement mo yung mga planong or plan of actions mo. So, review identifying information on each chart to ensure that you're updating the correct file. Ask clarifying questions when interacting with patients to gather detailed information. Take brief notes during appointment to guide in your in-depth SOPI chart afterwards. Add dates and times to each SOPI note to determine or to provide continuity in the patient's records. Use neutral language to uphold professionalism and avoid making assumptions. Kailangan po based on observation. Include all relevant details from your interaction. Only write SOPI notes about your own interaction with patients. Write neat, legible notes with consistent spacing to improve readability. When discussing multiple people, such as patient and their guardian, be clear with about whom each statement addresses. Only use abbreviation or shorthand if they are standard for your organization, and make new notes or add addendum to update a patient's record instead of altering previous charts. Yun yung mga ilan sa mga charting tips natin. So the example of SOPI, ipapakita ko lang sa inyo later on kasi ito pa we have the FDAR. So another nurses notes or progress notes na pwede nating gamitin is the FDAR. And FDAR is usually used sa kung saan tayo naka-affiliate such as sa NMMC, sa Cebu, or sa APMC. Ang ginagamit nila is FDAR. Yung SOPI kasi iilan lang yung mga hospital dito sa Philippines ang gumagamit ng SOPI, and usually it is used talaga sa other countries kasi it is more in-depth yung kanyang pag-assess or yung mga details na makukuha natin. So FDAR stands for focus, D stands for data, A stands for action, and R stands for response. So this is a handy way to chart and save time. So F, the focus. This is the subject or the purpose for the note. The focus can be nursing diagnosis. So pwedeng ilagay dyan is hyperthermia. Okay, acute pain, or a event or admission, transfer, discharge, or health teaching. Example, gusto mong health teaching on medication. So, pwede yan yung focus natin. And then, patient, event, or concern, such as ang concern niya is nausea, diarrhea. So, depende yan sa pwede ninyong or focus ninyo. So, madaming pwedeng maging focus. And then the data, this is the written in the narrative and contains only subjective, what the patient says, and objective data. So, ang laman po ng data na to is the objective and subjective data. Yung sinabi ng pasyente nyo and yung na-observe ninyo. So, this lays the supporting events or evidence for why you are writing the note. And then for the action, this is the verb area. In this section, you are going to write here what you did about the findings you found. So, ano yung mga interventions na ginawa ninyo para mas ma-increase ang well-being ng pasyente ninyo based sa data na nakuha ninyo. And then the response, this is the evaluation. Ano yung naging response ng pasyente ninyo when you are giving the or when you are taking care of them. Okay? Sometimes you want shorter response for several minutes or hours later. And then what is FDAR charting and why is it used? So bakit ginagamit yung FDAR? So it is a method of charting nurses use along with other disciplines to help focus on a specific patient problem, concern, or event. Kasi more on talagang ano to um, specific tayo, no? Sa nagiging specific tayo because we are focused on one area. Okay? And it is geared to save time and decrease duplicate charting. It is great charting method for nurses who have lots of patients and is easier read by other professional. That is why hindi masyadong ginagamit sa APMC yung SOAPy kasi nga it is good for primary talaga 1:1. If you don't have kumaga many patients, maganda yung SOAPy. Okay? And ang FDAR kasi is good for a lot of patients kasi konti lang yung susulat ninyo. And then, it also gives other professional a snapshot of what went on during your shift in a concise manner. So, yun yung ating reasons bakit ginagamit ang ating FDAR. So, here are samples. So, ito yung SOAPy. Okay? Subjective data, sumasakit yung tahi ko as verbalized by the patient with a pain scale of 6 to 10. Objective data, facial grimace, irritability, restlessness. Ano ang kanyang assessment? Usually, ang lalagay nating assessment is the nursing diagnosis. So, acute pain related to post-CS. P, at the end of 8-hour shift, the patient will report relieved pain from 6 to 4. Kasi this is, again, ang paggawa ng plan, it should be smart, specific, measurable, attainable, realistic, and time bounded. Remember, 8 hours lang yung kanyang mic one. So, hindi naman natin pwede na maging zero na agad-agad, no? Lalo na pag post-CS. Ito yung kanyang intervention and ito ang kanyang evaluation. So, this is a simple sample of a SOAPy. So, ito naman yung ating FDAR or ang progress note. So, we have here the focus or the transfer. Example, transfer post procedure. Okay, the data, receive patient back from special procedure, status post thoracentesis, dressing, dry and intact in left lower back. Vital signs, HR, ganito, ganyan. And then, patient drowsy but oriented, yan siya. And then, so, ayan yung data niya, no? So, yung action, hindi niya masyadong nilagay. But, andun niya ito na lang, sample lang, another. Okay, we have here pain. So, patient called call light, requesting pain medication, arrived to room. So, yan yung data. And then the action, morphine given. Okay, a reposition patient on the left side. And then the response, patient rate pain to 1 to 10 states, I feel much better. So, ayan, sa sign niya sa baba, kailangan may naka-signature na tama yung documented mo na progress note. So, makikita nyo, di ba, mas simple yung ating FDAR, no? Mas mabilis isulat compare sa SOAPy. Kaya nga, again, yung SOAPy is mostly siya ginagamit sa mga hospitals na, hindi masyadong madami yung patient and 1:1 yung care mo. So, medyo mapapahaba yung sulat mo. While as sa FDAR, para siya sa mga nurses na madami yung kanyang pasyente. So, that ends my discussion. I hope you had understood all the topics that I have discussed. Again, yung diniscuss ko po for this part 2, the intravenous fluids and also the nursing documentation such as the nursing care plan, the nurse's notes or progress notes na katulad ng SOAPy or FDAR. So I hope it will make you it will help you easier when you will have your duty in hospital kasi it is very important na alam nyo yung paggawa ng ganong basic nursing procedure. So thank you for watching and have a nice day.